All right. Hello, Corbin and Justine. It's good to have you with me, and I'm grateful for your investment in this time. Those who are watching, I'm sure, are grateful as well. To many of us, this question about the vaccine, the ethics, even just the mechanics of it all, is so outside of our realm, outside of our comfort zone, and so grateful for you taking the time. Briefly, Justine, why don't you tell us a little bit about your background, what you do, and why you're interested in this, and then Corbin, after her, do the same.
Yeah, I'm a biomedical engineering undergrad with a biochem minor, and I am wanting to be a nurse, and I'm really interested in genetics as well. I work at a pharmaceutical company that works on biomedical technology. So that's what I do currently.
Yeah, great. And a piece that's going to come up in just a little bit is that you also volunteer with Hands of Hope here in Tucson, which is dealing with trying to address the abortion issue and help women navigate and choose life. And so, as this issue within the vaccine and the questions about the morality, really the strongest anti-morality argument has to do with the use of fetal tissue. I'm just especially grateful that you in your own life care and advocate, and so this is a tension for you that you feel. Corbin, how about you?
Yeah, so I'm a PhD candidate here at the University of Arizona, and I actually use cell lines in cancer research oftentimes, including one of the ones that we're going to talk about. To help with cancer therapeutics, and ultimately want to have a research lab of my own. So I do a lot of the bench work and kind of the early parts of the vaccine used.
Mm-hmm. All right. So the first question I have for the two of you is that there's this particular cell line. You can tell us which one it is because I will botch it. But there's a particular cell line in question as people are talking about the Pfizer and Moderna vaccines, especially the further vaccines that come out. There may be others. But this particular cell line in question was originally harvested from fetal tissue. And so that has been expressed by many people as an ethical problem and a reason they will not use these vaccines. If you could just briefly talk about why is this cell line the one that is used, and in this case and so often. So Justine, you start off, and then Corbin, you'll jump in after that.
At a base level, fetal tissue has less immune reaction from our bodies or in different research. So they don't have as many markers on them that we would attack it with our immune system. So fetal tissue is naive, it's young, it also can grow a lot and not become cancerous. Like a lot of cells can just develop cancer because they replicate and their DNA gets mutated. And I'll let Corbin, the PhD candidate, go on further now.
Yeah, I mean, a lot of those things are true. And the second thing is, yeah, it's not cancerous, so it doesn't have a disease innately in it already. And then it can replicate many times, and that's in adult cells, each cell can only grow and divide so many times before it automatically dies and shuts off. With embryonic tissue and in the cell line, you could theoretically keep growing it for infinite, divisions, which is one of the reasons why it was used, even though it was initially harvested in like 1972. It's still being used today because of that infinite division capability.
Corbin, you actually do some of that yourself. Can you briefly tell us what it means to divide this cell line and just what that looks like in your lab?
Yeah, so when you get cells, you get a couple million cells in a little vial, and you use like petri dishes. You thaw it out, you put them in like 10 different petri dishes, and you freeze back in like -80 freezer, like 9 of them. You use that 10th dish, you keep dividing it. You take that dish, you spread it out to 10 more dishes. You do experiments with it. You freeze back 9 of those. You spread that 10th dish into 10 more dishes, and so you see this tenfold logarithmic divisions, and it's why one tube from the resource, the initial source, can can do, 1,000, 1,000,000 different experiments without ever having to get a new vial, because you can just keep going 10 plates and using that 10th dish and then the 10th dish of that and the 10th dish of that. And that's kind of one of the reasons why this cell line is the second most popular cell line used today in the industry.
Yeah, that's basically my next question is how common is it that this cell line is used? And you just said second most popular. I mean, are we talking, just give us some sense of how common is it? Here you are at the University of Arizona. Is this thing basically all over the world in labs? Or tell us a little bit about that.
Yeah, I mean, you'd be hard pressed to find a lab that doesn't use it in some way, shape, or form, because of the properties that it has. Um, I mean, I don't know if there's a single lab here at the University of Arizona that doesn't use it in some way, shape, or form. Um, and yeah, in the research, I mean, it's used even to do simple things. You can put your protein that you're studying of interest in it, and then into one cell, and then when that cell divides, your protein of interest divides that you can then harvest to use for other things. I mean, the uses are so ubiquitous that it would be hard to find a lab that doesn't use it or doesn't rely on research that used it, even.
So I think one of the things that's going on with Christians who care about the abortion issue is they don't want to touch like an unclean thing. They don't want to use something that's supported abortion. What would you have to do to get away from using anything that involves this cell line? And can you give us some examples of other, like maybe, I don't know, products or, things that do use it?
Yeah, I mean, well, the biggest one is any cancer therapeutic has used it at some point, either in testing the cancer therapeutic or the generation of it itself. So if you've ever had a family member done chemo, cisplatin, doxorubicin, all these big, frontline therapeutics were tested or created using this. But it goes even beyond cancer and vaccines. I mean, rabies vaccine, some chicken pox. If you've ever had the chicken pox vaccine, it used these in its research. But it goes even further that rheumatoid arthritis, type 2 diabetes medicine uses it. So if you know anybody who has diabetes, this has been used in that. Sepsis, if you've ever had a patient, in a hospital setting that has undergone sepsis, some of the proteins that we use to help treat this was generated in the cell line. And of course, the cell line in question here is something called human embryonal kidney 293s, so HEC 293 cells. And yeah, there's so many different proteins. Any protein that's really been studied has used this. You're talking stroke medications, you're talking immunotherapy, immunosuppressive drugs. I mean, yeah, unless you're talking about maybe high blood pressure that you need some sort of system like a mouse to test, because individual cell lines can't have high blood pressure. So unless you're talking about things like high blood pressure, it's going to be hard to avoid any drug that hasn't used this in some way, shape, or form.
Would we get down to even stuff that you could pick up off the shelf that isn't just over the counter potentially?
Some of it, yeah, and some of it, anything that's basically targeted at a protein or a pathway, beta blockers. I mean, any of these things that you can just get over the counter, anything that targets a specific protein, I can say with 95% certainty has either used this in development and testing this, or relies on research that use this drug in order to find a protein of interest in the first place.
Right. Something that you were telling me the other day when I asked you about this, we were just having dinner, and you talked about the reason that it's important to use the same cell line and compare to research in the past. So I think I would be asking the question like, well, why don't you just go get another cell line? Or Justine, you had once brought up that it would be possible if a stillborn baby or something of that nature that a cell line could be drawn potentially. It doesn't have to be from an abortion. And so my mind would just go find a different cell line. But why is it important that this one is used when comparing to research from the past? Can you help us understand that?
Yeah, so the biggest thing is a common baseline. You need a common reference frame for research that you read. Research back in the 80s used this line. This line has certain genetic properties. It's got 4 different chromosome 17s. It's got 4 copies of it when a normal cell should only have 2. It's actually got 3 X chromosomes, which normally you'd have 2 unless there's certain diseases. But there are certain genetic factors to this line that make it unique. And so if you were to use a different line, say an adult line, you'd have potentially any of the genetic mutations and variations in that line. So if you did a research study, you wouldn't know if the result you got was because of whatever drug you did or because that cell line had a different genetic makeup and properties. And so in order for you to use research that is, kind of old, like from the 70s, 80s, 90s, 2000s, you would have to use that cell line again. Otherwise, it'd be comparing apples to oranges. It'd be trying to, work on, a BMW using a, Ford catalog from the 70s manual. It'd be close. You'd have enough things, but you wouldn't know if it was quite right because it had a different set of blueprints and different instructions. So that's kind of why we still use it to this day.
And when it comes down to public health, you really need everything to be dialed in and for things to be tested very well, right? And that's
especially if you're going to be putting it inside of humans, you want to make sure that your the results and the safety aspect of it too.
Yeah. Before we go into this final question, Justine, anything you would fill in or anything that stood out to you from kind of your experience?
Just based on the last question, I was thinking that if there are scientists that are trying to find different lines, and it would take an overhaul, like saying, oh, it's going to be really hard. We'll be comparing things that are not quite comparable, which is totally, something to consider. But if we are going to move forward, it will take some work, and it's not so easy to just switch, but it might be validly worth it in a lot of people's opinions. So
yeah, it wouldn't be an unworthwhile thing to do, but I'm hearing it can't happen. It's not quick, easy, especially say in this moment, in the middle of a pandemic, we're doing something called Operation Warp Speed. However, if that name should have been used or not, right? But now's not the time to overhaul. Like you can't do that at a time like this, right? And so it's not an unworthwhile quest, but it would be a very long, difficult quest, basically, even if it should be done.
And it's possible. There are a lot of cell lines. The number one most commonly used cell lines is called HeLa cells, which were taken from an adult biopsy.
Which is also an unethical situation. If we're going to talk about, ethics of one cell line, we should also talk about Henrietta Lacks and how her cells were taken from her in totally unjust scenarios. Her family, I don't think, has ever gotten compensation. She had cancer. Look up her story.
Yeah, Corbin was telling me there's a movie about it, right?
The Immortal Life of Henrietta Lacks. Yep.
So even if you're avoiding this cell line, the other most popular cell line has issues, right? I will be talking with some of the pastors who are listening to this. If you're watching this outside of that scenario, there's a lot more to the conversation. There's a theological question, and can we not touch anything that has been imperfectly dealt with? I'm going to make the argument that there's no getting away from sin having impacted any of the systems, anything that we live within. But there's more to say about that. We can't say it right now. The final question, Corbin, why don't you start, and then Justine land us on this one because of your work and with Hands of Hope. But Corbin, as you're not a pro-abortion guy, but you work with this cell line every single day. How do you deal with that? What advice would you give to people who don't? I mean, you peer into this thing every single day. How do you reconcile it?
Yeah, I mean, I like to think even the situation behind how the cell line was created, was obviously not the way it should have been. But I strongly believe that what man meant for harm, God can use for good. I mean, all the drugs that I mentioned already have saved millions of lives. I mean, all of our cancer therapeutics, the battle to fight cancer has succeeded in large part because of this. And And so I know that my work is helping to save lives and to prolong life, and give people opportunity to spend more time with loved ones and family. And maybe that extra time actually gives them the opportunity to learn about Jesus and to accept them. A lot of people in the hospital situations and through battles with cancer end up, turning to Jesus. So that's kind of how I deal with it, knowing that God is in control and can use this for his betterment.
Yeah. Justine, what would you add to that? And even if you could just kind of speak a little bit to your heart for this issue, and how you, as someone who's very interested in cells and genetics, how you would reconcile.
So I agree completely with Corbin. God always takes our evil actions and makes beautiful things happen for either ourselves or for other people, future generations. Let's go with anyone in the Bible, and you can see so many, like Jesus's line, right? Read Matthew 1. The other thing is humans are not being actively aborted for this kind of research. These cells are not newly generated from terminated pregnancies currently. That is not going on. So it is a legacy thing that's happened, and God's used it for good. I think to reiterate what Corbin was saying, there's so many good things that have come out of it. And I think that scientists can keep working toward other lines. The other thing to note is, what about tissue donation? What about organ donation? Are we as Christians against that? Maybe some people are. I'm not. And I've heard beautiful stories of women who are getting genetic counseling for their child who has a genetic disease, who won't survive after they're born, and are given the option to terminate and choose not to, but instead allow their child a natural death. So maybe they live 3 hours after they're born, and then they make a courageous, in my opinion, decision to allow that baby to be, let's say their eyes are donated to another baby who also has eye problems. Their heart is donated to another baby who's also having issues. So that's just a tangential relation, I think, to this kind of line. There's a lot of good that can come out of really terrible, terrible things. So I'm curious, Andy, if you have any thoughts on what I just said.
Yeah, I wish we three could just continue on for a long time having this conversation. My family, we just read the Joseph story, where that very idea comes from, that what you meant for evil, God meant for good. It doesn't say what you meant for evil, God worked with it. That very phrase infers the sovereignty of God over all things, including directly evil and sometimes murderous acts. I mean, that is what happened in Joseph's story. Is the heart of his brothers was to kill him, and God used their evil act and actually saved the lives of the family through it. So when you two refer to that, I think absolutely. I don't think that has to make it okay. It doesn't make the original abortion okay, but it also means that you can be confident in God's redeeming power even through an evil that was done in the past, and even utilizing elements of that evil deed that was done in the past. So I theologically, I see that. I agree with that. And what you're saying, Justine, is absolutely, I think a key. There are so many ways that we as believers could, rather than just critique those who are doing things the wrong way, how about we get involved and make every move we can to provide better paths forward? I signed up for organ donation recently, and I don't know why it was a weird thing for me. It's like, I don't want my body to be taken apart, but why? I'm going to be redeemed. I don't need to worry about that. But it was like a hard step, and I get that. But I think that, and doing that with your child might even be more painful, but at the same time, you could help provide better ways down the road. So while we exist with the tensions, work toward better paths. Get involved, volunteer, don't just critique. And in the meantime, if you're waiting for the perfect solution that has no sin touching it, I don't.
Yeah.
Yeah.
What if the CEO of the company is cheating on his wife? Like, what do we do with that?
There just isn't anyway. I was describing to my wife when we talked about this, we were driving in our car. I said, can we say that every element of this car was ethically made? We don't even know. We're so in the dark. There's, yeah, and it's not. I guarantee it's not. Anyway, thank you too. I really appreciate it. We've got to sign off for this this time, but we're grateful for your input. Those who you aren't meeting right now, who are watching, I'm sure are very grateful for your input. And thank you for the work you do and for the ways that you wade into difficult waters to help save the lives of others. So thank you.